are there other emerging myeloma therapies that are showing promise?
Yeah, so I think, over the last few years, most of the buzz has been with these immunotherapies. And again, more work to be done there to see whether combinations, different schedules, different targets, different types, will, show more and more benefit in each of these myeloma disease settings. But we also have simultaneous development of other agents that are not in this sort of immunotherapy T cell redirecting therapy realm. We have newer versions of our classic immunomodulatory drugs, such as lenalidomide or pomalidomide. We now have their next generation agents called CELMoD drugs, and there's two of them in development. One is called iberdomide, one is called mezigdomide. These are, again, kind of building upon the success of some of these previous therapies that are kind of cornerstone therapies for myeloma patients. And because these are essentially better agents, they're more targeted, and they also have, greater response rates as single agents and as combinations. We're hoping that these would be approved in the not so distant future, and then perhaps will replace some of these immunomodulatory drugs that we have currently utilized, in newly diagnosed and relapsed myeloma. Essentially, what this means is things are just getting better and better and better as we get newer versions of some of these therapies. So those are, I would say, kind of next in line in terms of, hopeful approvals, and then we'll add to some of the, options that we have for myeloma patients.
How can patients and care partners stay informed about the latest myeloma research?
Yeah, it's a lot of moving parts all the time, from one 6-month interval to the next. You tend to have nowadays, perhaps some drug approvals, which is, amazing. But if not else, updates of all these sort of combination trials, et cetera, where things are going. I think kind of talking to your physician, obviously, about some of these updates is really critical. As I mentioned before, having a roadmap in your mind about what the myeloma therapy for you may look like, going forward, wherever you are in your disease state, is always important because it gives you time to sort of think about it, learn about it, prepare for it. Some of these therapies really require, an effort from the patient and their caregivers. Because, for example, for CAR T cells, if you're not near a center, you may have to relocate for a month, and it's very difficult. And we fully understand that and try to help as much as we can. But that's the kind of commitment that it takes. So talking to your physician, obviously, content like this, reviewing this as much as you can, on the online patient support groups are great because you learn from other patients' experiences. So good news now is we have so many channels of communication, but you have to, in a way, in the end, discuss with your physician and verify things you may find on your own.
Exactly. Yeah, you want to make sure you're getting facts rather than
Right.
fiction.
That's
Yeah.
right.